All right. So good evening once again. This is LD Remedial World, a platform for training and coaching teachers and parents who are working for children with learning disability, ADHD, autism, or any kind of mild disorder where they need academic support. So we are creating top-class remedial educators is what is my mission, because the special educators of this country are too busy looking after 21 different disabilities, and nothing, they do not have enough time for children with LD especially or ADHD who are in regular schools. So Deepti ma'am, thank you so much for accepting this invitation. Deepti ma'am is basically a PhD in psychology. She's a clinical psychologist. She's dealing with adults, couples, and adolescents. Deepti ma'am is working on individual therapy, couple therapy, tele-mental health. Wow. Team CBT trainer. She's, I think, India's one of the best team CBT trainers. And she attends many, she's still learning a lot. I keep sharing various groups that she's gone for some training to US, or she's going to take some, attend some more workshops in Canada. I keep listening in the various groups about her. Dr. Deepthi Joshi, her specializations are relationship problems, addressing these problems, that is individual mood therapy, including depression, unwanted habits, and addiction, anxiety disorders, OCD, eating disorders, grief, pregnancy, prenatal, postnatal mood swings, parenting, cross-cultural identity. Wow. Life transitions, amazing areas, career challenge or work concerns. And she's been doing one-to-one and group trainings for many, many years now. She's got two beautiful daughters, and one of them is a psychologist, ma'am, already.
Yeah, on the way.
On the way. All right. So we welcome you to this platform, and over to you, ma'am.
Thank you so much for the wonderful introduction. It is actually an honor to be with you once again. We have actually got a long association. We were together in Surat, and then here and there we kept meeting, and then we are here now. So yeah, thank you so much for inviting me. In fact, I was just wondering today since morning that I haven't been in touch with special children for such a long time. And I had actually started my career with in a special school. I mean, children with special, I used to go for my first internship in one of the schools near my house, which was of special children. So I have a special affinity, I think, for children with special needs. But I was just listening to you, and you mentioned that over here we have in the audience parents and teachers of children with specifically learning disabilities, right? Not different kinds of disabilities.
Academic disabilities, I would say, because I am coaching only on academic disabilities.
I see. Yeah, that makes it a little more clear for me, because communication is such a vast area, and I was wondering, I wanted to cater it to as per your requirements. So I think that makes it like much clearer to me that this is mainly we want to develop communication methods to be able to communicate better with children who have intellectual disabilities, or maybe specifically academic disabilities. Not necessarily they may not have intellectual deficiencies, but maybe a little bit of here and there, just as per their learning disabilities, right? All right. Yeah. So I think it is very, very important to have specific kinds of techniques and tools available so that you can effectively communicate with those children, at the same time demonstrate some communication methods, model them in front of them so that they learn those communication methods with you, and then they themselves practice it. So I believe that is the main goal, right? Because as teachers, I think all of and parents, all of us are playing very important roles in showing them that how communication has to happen.
Yeah.
So yeah, keeping that in mind, I think I would like to have our conversation today very much like a conversation rather than me just giving you any lectures. So I'm going to very quickly say in about 15 minutes or so, I'll just let you know what are some of the main points which I think are important, and then we can take it up as a question answer round. As in, if you are struggling with some real problems with your children or your students, I would like to address those specific questions. How does that sound to you?
Perfect, ma'am. Perfect.
All right, yeah. Well, so when I think of communication, I think the first word that comes in my mind is connection, isn't it? We
Yeah.
want to establish a good communication system in order to be able to connect better with our students, or with the teachers, or even the parents of children with special needs. So there's so different areas where you might need some specific kind of communication methods. So I think each and every place, one thing is common, that we want to establish a good connection. Because as teachers, I believe you do know some things more than your counterparts. So you will have to direct them in a specific direction, right? Whether it is student in front of you, or whether it is the parents of those students, right? You may
Right.
have to direct them in a specific direction. And in order to direct anybody, it is extremely important that you make a connection with them first. If you are not able to connect with them, they will not be ready to be directed in any specific direction, right? So I think keeping that in mind is extremely important for, as per my understanding. So when I think of that, then there is a need of two-way communication. So there is a need for us. So I'm thinking it from the teacher's point of view, or a parent's point of view. I mean, if in front of me there's a special child, then it is going to be very important for me to first try to understand that what
Mhm.
is being told to me. Seeking to understand is extremely important. And then communicating what I understood in such a way that the child in front of me feels understood. Just me understanding is never enough. I think we have to let the person in front of me feel understood. That is extremely important. That's one part. And so this is about what is happening with the child. So with the child, there are two things that is important. One is that we have to try to understand the other person. We have to understand the child, and then we have to express what we understood so that they start feeling understood.
Hmm.
And then comes another part wherein we have to be crystal clear in expressing whatever is our side of the story, so that they are not left with assumptions. We have to let them know clearly whatever is going on in our mind in a very open, honest, direct way, so that they understand us. That is also our responsibility.
Hmm.
So say, for example, I'm thinking of a child with a learning disability. If the child is not able to learn some basic alphabets, or is not able to do the math very clearly, and I'm trying to make that child learn, after a point, if I am feeling a little frustrated, I think it is important to let the child know,
Hmm. Okay. Wow.
rather than letting the child left to assume, because that will confuse the child even more. I'll come more to that. So this is just a second part. I think that was one part which tends to get neglected a lot. So one is try to understand, express what you understand, and then also make yourself crystal clear so that you are understood by them. So you have to be very clear in what is your part of the story.
Hmm.
So while all of this communication happens, I think the third component, which I would consider that as an umbrella to all of this, is that we have to continue to remain extremely respectful in our verbal and non-verbal stance.
Hmm.
Because when we are communicating and making a connection, it is very important that that person is wants to be in your close vicinity, right? If you're
Hmm.
going to do some things where the child doesn't feel like being with you, doesn't feel safe, then they will not listen to whatever you're saying.
Yeah.
They're not going to even hear that. Even if physically they are going to be present, but still they won't be engaged in the communication.
True.
So the respect is extremely important, whether it's a little child, whether it's a new neonatal child, even a 1 year old, one day old child might also need respect. So that's a basic instinctual need. So we have to be able to cater the need of the child, and as per that, provide that kind of respect. So these are the three main things where we have to try to focus on. And I can share with you some of the communication techniques so that you can make this effective.
Okay.
How do you do that? How do you make the child feel, first understand the child, and how do you make the child feel understood? So I think it is extremely important in this stage to try not to assume too much. So I think as special, I mean, as teachers of special children, or if we sometimes we automatically tend to take a superior stance, assuming that we know better than them.
Yeah.
And I
Yeah.
think that is the biggest
Biggest
mistake.
mistake. True.
So we need to come to their level and try to understand them by very gentle probing questions and ask them, rather than assuming for yourself that you know better than them, that what are their needs, or you assume that you will understand them. But that is where we tend to make mistakes. So learn how to ask questions in the most gentle way, so that they can feel safe to be honest and let you know what's going on their end. Suppose if the child is not able to write or is not able to understand maths, we have to be able to provide a safe place to the child, so that the child can tell you that this is exactly what I'm not understanding. So for that, you also have to ask them. Sometimes you have to provide a multiple choice kind of a scenario where you ask the child that, tell me, is this happening? Are you not understanding this? So then they can quickly tell you that what exactly is happening. But assuming, just because you don't have to go through the process of thinking on their behalf and come up with 5 options, may not be the most effective approach. So it is extremely important to make that kind of effort to be able to put yourself in their shoes and try to imagine how the world looks like from their perspective, and then accordingly try to ask them questions so that it becomes easier for them to answer. Right? So I think it always, so when I say 3 parts, so Dr. David Burns, who is one of my mentors, he has given a very good tool of communication. He calls it 5 secrets of effective communication. And I would love to share with you, because this is going to give you a formula, as in how do you effectively communicate with children with special needs, or whoever is in front of you. In fact, this is such a broad tool that it can be applied to any scenario. So right now I'm thinking from the perspective of a parent or a teacher, where you have to communicate effectively with children or individuals who are who have academic disabilities, right? Who have academic learning disabilities. So keeping that in mind, we are going to try to see how you could effectively communicate with them, so that they can understand you and you can understand them, and then collaboratively work together towards whatever the goal is. Right? How does that sound to you so far?
Absolutely. Ma'am, can you also give us with examples?
Yeah, I think that would be great. Yeah, that would be very nice. In fact, I would love to get those examples from you, your challenging situation, so that I can tell you how we could apply that formula as per your requirement, as per your scenarios. So I'm
Perfect.
just wondering if I am will I be able to share the
Yeah,
screen?
yeah. I have already given you, ma'am.
All right, okay. So I'm going to share with you this tool. And while I do that, I'll share the screen with you, and I'd love to get some examples from you. I think that is going to make it most effective. So this is the tool I was talking to you about. It is called Five Secrets of Effective Communication. So Dr. David Burns says in a very brilliant way, he says that we must talk with our ear.
Lovely.
Isn't it beautiful?
Yes.
Yeah. And I think more beautifully, he has described this acronym with these three very beautiful concepts. So the E of the ear stands for empathy, A is for assertiveness, and R is for respect. So E is primarily what I was telling you, the first part, where you try to understand the child and express what you understand so that that child gets an opportunity to clarify further whether you have understood him or not. Only that child will be able to tell you whether you have understood him or not. So this is about that part, and I'll quickly come to that. The second piece is assertiveness, wherein you become crystal clear about your part of the story so that the child, it becomes easier for the child to understand you. In short, you take complete responsibility of being understood as well, rather than blaming the child's deficiency for him not understanding you. And then the last one, as I said, is respect, which comes with a capital R. As I said, it's an umbrella thing wherein you have to continuously uh, say some things in such a way that the child starts feeling safe in your company so that they remain there while you do the communication. Right? Now, coming back to empathy, there are three principal components in using this method to be able to communicate in a way that the child feels understood. So over here, the first of it is called disarming technique, wherein you try to find some truth in what the other person is saying. And over here, I would love all of you to have some examples in your mind so that I can then explain to you how you can apply this tool through the very challenging situation that you have with a child. I'll just explain to you and then we'll quickly take examples from you. If you do not have examples, I do have some experience with working with some special children, so then I'll take that up. So, well, the first is called disarming technique. That means that we have to try to first find truth in what the child is trying to tell you, even if it is unreasonable. So, say for example, the child is really frustrated, and the child tells you that, you know something, teacher, I don't think you like me because you are pressurizing me for trying to write this page, which I don't like to write. And from that, I'm thinking that you don't like me and you don't care for me at all. Now, on surface, this may not be a reality because you do care for the child, right? And that is why you are in this profession. But over here, rather than defending yourself, it is very important to try to understand what the child is trying to tell you when the child is telling you that I don't think you like me or you don't care for me. So we have to still find the truth and try to find the music behind those words and then reflect back on the child. So for disarming, what I would say is that yes, beta, I think you're right. I am not right now showing you that I care enough for you because I am trying to expect something which you are not able to do. And that definitely shows that I'm not coming across as a caring person to you. It's very important to agree with the child rather than start becoming defensive. Because when you agree with the child, then only the child will start feeling safe, right? And then, so that's the first part, because once you disarm yourself, then the communication starts opening up. Because if you're not defending yourself, the child will not need to further attack you or, further tell you those unkind things, because you've agreed with the child that, yeah, you're right. I am not showing a caring side of me right now. That's true. Then comes the second part, which is called empathy, wherein exactly you try to put yourself in the child's shoes and see the world through his or her eyes. So for that, you have to do two things. One is we call thought empathy, wherein exactly paraphrase the child's words so the child starts feeling heard. So over here, when the child is telling you that you don't care for me, I would exactly repeat the words. I'd say that you're telling me that I don't care for you. And then immediately after that, you try to imagine what the child is feeling when the child is saying something like that. What is the emotional makeup of the child when the child is feeling that? I mean, saying something like that. So I would combine these two, and I would say that, you are telling me that I don't care for you. From that, I'm imagining that probably you're upset with me and you're probably feeling a little let down or angry with me. And then pause. Ask question that, am I getting you right? Tell me more. What is it that you're exactly feeling right now when you're saying this to me, that you don't care for me? If you notice over here, I'm not telling anything about my side. I'm just I'm trying to understand the child, and then I'm expressing to the child that this is what I understand what you're telling me. Let me bring it all together. So the child over here is telling, teacher, you don't care for me. And I'd say something like that, yeah, you're right. Right now, I'm not showing the caring side of me. And when you're telling me that I don't care for you, I'm imagining that probably you're upset with me or you're not feeling understood, and you're also probably angry with me. Tell me more. What is it? What else are you feeling? I'm here to listen to you and understand. So if you notice, over here, I'm demonstrating a lot of care and affection to the child through my attitude, through what I'm doing. So I'm not telling the child that, no, I care for you. That is such a shortcut. It doesn't happen that way.
Yeah.
You have to actually demonstrate. You have to do that. And the child will definitely feel it.
Ma'am, is
Right?
it not the same for even regular kids? Why special needs? I think it's the same for everybody, no?
Yeah, that's absolutely true. This is a tool which is applicable for everyone. And it is so beautiful that it can be tailor-made as per the child or whoever is in front of you. So right now, when I'm thinking of a special child, I think it takes a little higher capacity to be able to
Yeah.
imagine that what the child is actually feeling. So I that's the reason I was saying that I would like to get some specific examples from you all so that we can then take it as per what kind of experiences you have. This is just one example I thought I'll just share with you so that I can tell you about this tool, and we'll quickly go to, your examples. So now coming to the second part. So this was about trying to understand the child. Now this is my side of the story. I also need to let the child know that how I feel when the child is saying something like this to me. Because usko nahi pata chalega jab tak I am not going to tell. So I'd say something like this very genuinely that, something, I am also feeling very sad right now. I'm also feeling a little disappointed in myself that I'm doing something that is making you feel uncared.
Wow.
That would be my side of the story, because until unless I don't and this is the mistake most of the parents or us as teachers we tend to
Teachers,
do.
we do.
We do not show the gentle side of us, which is always there, and that is why there's so much of miscommunication, misunderstanding between teachers and students, any student, let alone special kids. So I think it's very important to let them know clearly how you feel in that moment. Even if it is something like, if you're upset with the child, say for example, you are noticing the child is misbehaving, or purposely doing something which is harming someone, and you have instructed the child 10 times. After that also the child is not obeying you. In that moment also, it is very important to let the child know that how you feel. Say for example, I'm feeling upset and angry with the child, so I think I would let the child know, but not in an aggressive way. I'd
Mm.
make use of these words, the vocabulary. So I'd say, something, I'm feeling upset with you, I'm feeling angry with you, and I don't like that feeling when I feel that towards you. I hate feeling angry towards you. But right now, that is a reality. I am feeling angry. That will have a very different stance and different effect on the child. They will be able to understand what is going through. अगर आप गुस्से होके बोले मुझे तुम पे बहुत गुस्सा आ रहा है, तो the child will start defending. उसे कुछ सुनाई नहीं देगा. So you have to express whatever you say with that gentleness. And that's where this last part comes, the attitude that we have, the tone of voice that we have, all that makes it very respectful, the conversation between the two of you. Sometimes you can also say some verbal things, like you can say things like, I really like you, and I do have some confidence in you that you will be able to complete this page of writing, and I think that was the reason I was asking you to do this, but it seems I have not understood that well. And right now you are feeling that I don't care for you because I've asked you to write down these 10 lines, which you probably are finding it difficult. So maybe I am making some mistake in my judgment. So I'd like to hear from you what it is like for you when I asked you to write this, because you are telling me that you feel that I don't care for you. So that would be some of the ways to communicate. Now, I'm just stopping the screen share because I'd love to get some examples from y'all, that what kinds of challenges you face while communicating with children. So I think then I'd be able to answer this question even better.
So Deepti ma'am, before you joined, there was one teacher who's recently joined our community. Bharati was sharing a problem that she has a child in a class who recently lost his mother in the COVID. And since then, the child has been a very withdrawn child, non-communicative and crying all the time, and she's not able to address that problem. So would you like to throw some light on that?
Yeah, this is grief, so this is, the child is feeling sad and probably lonely and upset. So I think it is very important. First, I'm trying to put myself in that position, that what is the first thing, and as I said, the first thing will be connection. Before sharing, the child needs to feel connected with you. So I think a lot of patience will be needed with this child, where you remain with the child in close vicinity and just do some activities with the child. Depending on the age of the child, how old is this child?
I think in the primary class, grade 5 or
11 year old. 11 year old.
I see. Yeah, that's a really young child. And it's very, very sad that the child is, has lost the mom. And so what I would do is I would just stay with the child and continue to do whatever the child is doing, and then take interest in the activity of the child. Say, for example, painting or craft or whatever. And then I'll continue to do that. And then very slowly I will weave into that conversation, that, yeah. And asking more questions, I would just say that, tell me, what do you like, do you like red color or do you like pink color, while ask, so first I would give that multiple choice, and then engage the child so the child starts feeling understood, and then yeah, comfortable. At the same time, I will keep um, stroking the child a lot, as in, I would continue to appreciate the child's effort, whatever the child is making an effort, and then slowly ask that, I'd like to know from you, what do you like? What would you like to do? So beginning with a multiple choice and then slowly graduating towards open-ended questions. Very, very gradually. And then also asking that, how are you feeling right now? Rather than asking about when your mom died, how you're feeling. I think it would be very nice to begin with this moment while you are with me. How are you feeling? Are you liking it? Are you not liking it? Are you feeling happy? Are you feeling sad? And I think educating the child with those vocabularies is also going to be very important with this child. Because you say, even if the child is feeling sad, I'm not very sure if the child is going to be able to express that what she's actually feeling. So sometimes through pictures, you can educate the child about the vocabulary of different emotions. So emotions of anger, frustration. I guess that's a protocol, right? In a special school, that you have those different emoticons, and through that you can start asking the child that, tell me which emotion do you connect with. So if you want to make it even more gradual, you can show in some picture, some storybook, and then ask that, okay, in this story, what do you think this child is feeling? If it is anger, angry, or is it sad, or is it happy? And then slowly graduating it towards the child and asking that, okay, tell me, how are you feeling now? And then I think very gradually you can bring in those mother-child, kind of pictures, and then see how the child is responding to that. Because I believe this child will be very close. She may not be feeling safe to talk anything about the mom.
True.
So we have to be very, very gentle, and then slowly ask that, do you want to tell me a little bit about your mom? What do you remember about her? What did you like about her? And I would definitely begin with some good memories and help the child rewire that once again in the memory network. And I think the child would love to open up with that part. When someone is, sharing with the child some good memories. And when that starts, when the child is so taking the present stance and then further past with some good memories in the picture, and then gradually moving on to once again this moment in time. That what is happening right now with you? Something on those lines.
Fantastic.
Yeah.
Can we take more?
Yeah, sure. I hope that answers the question to Bharti.
Yeah.
Bharti, right? Bharti was asking that.
Yeah, Bharti.
Yeah. Thank you so much. Thank you.
Most welcome. Yeah.
All right.
Yeah.
Who wants to ask question next?
May I, ma'am?
Sorry, I'm not able to look. Who is this? Can you?
Sony, ma'am.
Bhageshri.
Somebody else is also there, ma'am.
Yeah, Sony is also there. Yeah.
So let her finish.
Okay, Sony, can you ask a question? Can you come on camera, Sony?
No, ma'am, I'm outside.
You're outside? Okay.
Yeah. My question is simple and I think common also. How to deal with denials?
You're a parent. Bharti,
Yes.
sorry, Sony is a parent of a child with autism. Mild autism, I think.
So now he is verbal and he understands most of the language that we use for his age. But still, we don't understand sometimes how to deal with denials, because when he is in denial mode, communication is little difficult. So how to deal that?
Deepti ma'am, you're mute.
Yeah, I'm so sorry. Yeah, I think that's a nice question. But if you could give me a specific example of what kind of denial is the child is in.
So now he has a language. Like we only have taught him that if you don't like anything, you can say a no, or you can simply use. We have taught him a proper way to deal with negation. So every now and then he is using that. For every new activity, for every new transition, he will be giving us the words. no, I don't want to do this. No, I don't like this. So now we are confused. We only have given him that thing, but how to push him beyond that now?
Yeah. Have you also given him what does he like to do?
Yes, but that is mostly he's comfortable inside the house. With transitions, he's simply using the words that we have taught him. I don't like
Yeah,
it. It's difficult. I don't like the teacher. The school is very difficult. I don't want
I
to go.
see.
So
Correct.
he is using proper language now, but now we
Okay.
are confused how to deal with it.
Yeah. So if you could give me an example. So with these negations, what happens that becomes a challenge for you? If you could give me a specific situation, what does he say and how do you respond to that? I think I would be able to tell you more clearly, as in what you could respond differently.
So the simple thing, like he's going to school and he's coming back with the language. I mean, just after coming out on the gate itself, he will start, Mama, today last day of the school. I won't go to school tomorrow. School is very difficult, and he will continue that. So that time I'm ignoring all that. So when he comes home, still I won't tell anything, but as in the morning again he has to go, so in the evening I start preparing him that it's
Wow.
okay. We are not going to go to school for the entire week. We are having the holiday on Saturday and Sunday, but till Friday you have to go. I
I
promise
see.
I will come 1 hour before. But now
I
this concept, as soon as I say that no, till Friday you have to go, he will again start that,
correct.
no, I don't like
Yeah.
it, it is difficult, no, I
Yeah.
don't like it, difficult.
Yeah, I get that. So I think this is an excellent example now. So yeah, there are a couple of things that are happening over here. So I noticed that, when the child is telling you right at the gate, that, he is not liking the school. So he's saying, this is the last day of the school. I'm not liking the school. I won't go to the school. Now over there, the child was ignored. So when he came home after that also, the main, we were not able to agree with the child. We were not given any, we have, I mean, if I am in that position, I would feel that um I have not given enough place for the child to express more clearly. So I know it is challenging, because I do understand as a parent from your perspective, Soni, that you do want the child to go every day, right? And that is why it becomes very important for you to be able to convince the child. Am I getting that right?
Yes, ma'am. That is what.
Yeah.
But there were three scenarios. I mean, initially I used to respond, but as soon as I used to respond, then he used to be into behaviors like screaming or shouting. Because we try to tell them it's okay, fine. And as soon as I reply, the behavior used to show up.
Yeah. So I get that. So there must have been some of the things that you've done that has not been effective, and that is why you're finding it challenging. I get that. So I would just give you another way, probably, and you can let me know if that works for you. Because at the end of the day, you want the child to go willingly, right, to the school, and that's something which is not happening. Am I getting that right?
Yes, now actually he is going. Now the challenge is in the school he is withdrawing.
Yes, exactly. So
So
he managed to
now
obey
he has
you.
gone. Okay, Mama, I go from Monday to Friday. I'll go to school. Saturday, Sunday is a holiday. He's very excited about the holiday.
Yeah.
But in the school now, he is in withdrawal mode.
Yeah, I could imagine that this is exactly what would happen, because he is not ultimately going willingly, right? So even if he's going, he's found a way to disconnect over there. So what is the point of going to school then?
Yes.
So even though you have managed to convince the child to go, but then he has managed to find his own way of still not going to school, even though physically he's taking his body over there. So I think that's where we have to be a little more patient. Like, I would do this, I would handle this in a very different way. So what I would do is, as I was showing you the format, so the first thing I would do, even before, so for example, if the child is telling me on the gate itself, I would start agreeing with the child over there itself. So I would say that it seems you're upset about something that's happened in the school, and I'd love to hear what's happening. Let's go home and let's change, and I'm going to give you, I'll listen to you that what's exactly happened, because I care so much for you, and I'm feeling a little worried and concerned that, you're going to school and you're not liking, something is definitely happening which needs to be attended to. And then after coming back from school and, doing all the chores, before the child opens up the topic, I'm going to go and tell the child that, something you were telling me on the gate, that you don't like going to school. Tell me more about it. What is happening over there? I would be very much eager to hear and listen to you, what's happening. And there is exactly the child will get an opportunity to just, uncover or just get unloaded, rather than, creating that defenses. So I'm imagining the child is not given a chance to express what is actually bothering the child. The child's mind is still thinking that, what do I do so that I can convince my mom? And if my mom doesn't get convinced, what further I do so that I don't have to go to the school? Or I avoid some of the things that we still don't know what he's trying to avoid. So I think it is very important for us to get at a deeper level that what is exactly about the school that the child doesn't feel like going there, rather than just looking at the surface of just sending him to school because he's supposed to go to school and come back. So and over here comes all those components wherein we try to understand the child and then express what you understand. After that, you also will get an opportunity to let the child know that why it is important for him to go to school, and have a conversation about it. So once you have heard the child completely, respectfully, the child will have that space to take in whatever is coming from your end also. But if you haven't given enough time to listen to the child is still occupied with his own defensive. So whatever you are saying is not going inside. You see that? So we have to, it's not just with special kids, as I said, with everyone, you have to listen first. Understand, let them get unloaded completely and let them feel understood. And you can ask them that, do you think I understand you completely? And once they say yes, after that comes a chance for you to express that, after I understand you completely, now this is what I have to say. And tell me, what do you think about that? So I think with special kids, it can become pretty challenging. But even if in the process, the child doesn't go to school for 2-3 days, I wouldn't mind. But every time I'm going to be the one who will open up the conversation, that I'd like to know more about it. And, when you are open, the child gets exhausted. And then the child will himself start feeling that actually it's not as bad as I was imagining the school to be. But if you're not giving the opportunity for the child to express, the child is going to make it worse in her own head in order to convince you. And then they will start believing that lie. They have created that lie to convince you, because in the first stance, you were not getting convinced. And in the process, they start believing the lie, and that's where then it tends to become complicated. Are you getting it?
Yes. So
Yeah.
I got it. And even I try to do that. The problem is the child being on autism, he can't narrate the things.
Yeah,
So
see?
you have to read between the lines.
Yeah, that's really, really challenging. So that's where, we have to be really patient with the child. So the child may not be able to narrate, but the child will still have its own non-verbal language, and will still, even if they are not able to narrate, your stance will make the child feel understood. And that's all the child needs. The child doesn't need to tell you the story. The child needs to feel that you are in the same team with him.
Yeah. With that only, probably I am able to at least send him happily in the school, but I don't know how he is dealing with it. And break also I have already given him for 1 week, as when he started saying that I don't want to go, for entire week I didn't send him, just respecting him that, okay, fine, you don't want to go, let's not go to school. So
Yeah,
after
I
1
get,
week,
I
he
get
will
that.
get to
So
know. Yeah.
yeah, I get that. So it is challenging, and I can see that there is some resistance coming up from your end, that probably convincing him would be a better approach, because it seems it has worked for you in some ways. So I won't know much, because frankly speaking, I do not have too much of experience of working with autistic children. So there could be some specific ways in which you could connect at the emotional level with the autistic children. So I would recommend you to get a little more educated about that, because I think over here there is definitely some emotional problem, and it's not just about the school. There's some lack of connection, as per my understanding, between you and the child, and not about the school.
So it's just separation anxiety. He wants to be with me.
Yeah, so that's where there is something about it, like, the separation. What it is that? What is making the child feel anxious? What is the child worried about? What will happen if he gets separated from you? I think these are very deep questions which we need to address in a therapeutic setup, I guess, because there's so many techniques through which I could uncover some of your own core beliefs and some of your own stance, and we can take it forward. But at the end of the day, I would still continue to um, believe that it is very important to understand the child and make the child feel understood before you try to advise or expect anything from the child.
Related to this denial only, I want to ask a question. Actually, I am badly dealing with my own daughter. Whenever I want to say something, she pretend that she's not, like, why you are not studying, go and study, you are watching TV whole day. She pretend like that she's not listening. Oh, and she goes away from that place. So
How
I
old is the child?
she is
How old?
11.
I see. All right. Yeah. I can see that, these pre-teenagers, biologically also, they are going through so many changes, and they have a very different way of processing information as per what we have. So sometimes we have certain kinds of expectations that they are not fulfilling. But as parents, I think it becomes very important for us to still try to understand and put ourselves in the position of the child and try to understand the child, rather than in our own mind, um, in some ways blaming the child that there's some problem with the child. It could be, I'm not disagreeing with that part, that the child is making it challenging, but there is always a way around the challenge. So if we continue to keep thinking that what can I do in this scenario, even if the child doesn't change at all, then I think you can have better insights rather than expecting that the child to do something to make this easier for you. I think that's where we stop developing our own creative abilities to resolve problems. And I think it is very important. We are already blessed as compared to the children in so many ways. So I think it becomes our responsibility to up our game rather than expecting the child to make things easier for you. So yeah, that would be my stance about this as well. I wonder, how does that sound to you?
Brilliant
Was this
answer.
Bharti?
Brilliant, because what is it that you can do if the child is not ready to change? It's the only thing that you can think of at that time. All right. Do we have the next question? Kavita, you want to ask a question? Yeah. Can you unmute yourself, please?
Hello.
Yeah.
Hi, ma'am.
Another
Hi.
parent,
Yeah, ma'am.
Kavita. Yeah.
Hi. Ma'am, I had a similar question to, like the other parent had. My son is finding difficult to go to the school. And he calls only me and my husband as his best friends. He's mild autistic and he's got a lot of sensory issues. And he was so excited to go to school by bus by himself alone. And somewhere I feel that's where we made a mistake. He went alone, but then there was a withdrawal. He didn't eat there, he didn't mingle with anybody. And just after 3 days, now it's school means it's an aversion. So I'm going and sitting with him every day.
Oh.
So I don't know how to wean this off.
Disconnect that. Yeah, I get that. So there are some connections made in the child's neurobiological setup already. That, if he, so there seems to be, I mean, there could be so many different things I can think of. But to me, it sounds that the child is probably feeling a little anxious, being by himself. So I think you may have to, in spite of him not wanting it, you may still have to indulge him into that process of experiencing some of the anxiety, even in your absence. So this is something you can begin at home. And I know it is extremely challenging, but if you are able to willingly make him do an experiment and letting him judge for himself that how difficult this is going to be, and then set him up for success. So say, for example, at home, he's finding something. So he's finding it very challenging to go to a dark room, right?
Yeah.
And then over there you challenge him, and then you say that, I don't think you're going to be able to do. Do you think you will be able to do it? And if the child is in a little confident state, you've got to approach this a little paradoxically. And if the child is ready to do that, after that, give him lots of praise. And you just say, I'm so shocked and surprised that you are able to do this. And let's see what else you can do, which I think you can't. And then you can connect gradually. If 2-3 such experiences happen, he has some successes in his kitty. After that, you can connect that with the school experience as well. You can say that, so many children don't come with their moms, and I don't think you can do that, right?
Okay.
It's very hard for you. I don't think you can do it. And then you can say, but I'm thinking of this you did, you could do this, you could do this. What do you think? Do you think you can do it? No, you can't do it, right? So if you approach it in that fashion, I guess slowly he will start thinking differently, because he will then start connecting in his mind whatever successes he had because of his own faith in himself.
Okay.
So maybe if you could try that approach, and you can let me know if that works. I'm just making a, just assumption based on my own experiences with definitely extremely, average or normal people. So I'm not very sure whether this will work or not, but I'm just expressing this based on some of the human psychology principles.
Okay.
Wherein, it is generally thought that direct approaches don't work, especially when there is resistance.
Okay.
If there is resistance, वो सीधी उंगली से घी नहीं निकलता है फिर. वो थोड़ा सा टेढ़ा करना पड़ता है. And that's where, as parents, you may have to be a little more creative and try to take it paradoxically.
Okay.
Yeah, I think that would work in this scenario.
I'll try, ma'am.
Hello, ma'am.
Thank you, Kavita. Bhagishri, there are 2 questions I already in the posted here. So let me just read out. Yeah. It says, ma'am, what about much more younger kids? Kids with special needs have speech issues and sometimes even show resistance. Deepti, the question is not very clear to me. Can you ask if you're there on the screen? Deepti? Are you coming to ask the question?
Yeah. My question to Deepti ma'am was, actually,
please.
I'm a teacher. I'm a nursery teacher.
Okay.
The cases that some of the parents have said that children somehow have agreed to school. What about the teacher dealing with such children who just get into a shell? I've been struggling with a 3.5-year-old. She wouldn't even respond. Total resistance. When I try and approach her, we have 2 teachers, mother teachers with her. Either of us, if we do not approach her, she's okay. She'll keep observing us. But if we just try and come to talk to her, she'll start crying. It's kind of a total resistance. We try and feed her something, she doesn't. For 4.5 years, for hours, she will not even get up from her seat, speak any word. It's becoming a little okay, how do I build a connect with that child or put any kind of a communication that I can work to get certain results out of her?
Yeah, I think this is definitely again quite challenging because the child hardly gets enough time with you, right? So I think a collaborative approach from parent as well as teachers will be required with this child. As per my understanding, just you alone may not be able to, resolve this issue. Uh, I have a feeling, although we need to assess the child, that there seems to be some kind of anxiety related to adults, and this may be coming from home. We don't know. Sometimes adults do not understand that they have to come to the child's level and try to communicate. If they start to expect too much from the child before the child is ready, then also the child tends to develop this defense mechanism of not connecting. They just shut off. So the child is not feeling safe among adults. So I think that's the first thing I would encourage parents to do something about it. And with respect to teachers, I think what I would recommend is, whenever you communicate with the child, be at the child's level, at least the height wise. Sit down with the child at the same level, so the height of yours and the child's height is same, and then you can start engaging in the activity in whatever the child is doing. If suppose the child is playing with some jigsaw puzzle, very non-verbally, if you can communicate with the child and just try to follow the child's instruction to you. I remember when I used to go to these special schools, and this was like almost 20 years back now. I think that time I remember I used to love working with these kids, but what I would do is I would tell them to tell me what I'm supposed to be doing, and they would enjoy doing it. They loved giving me instructions, and in the process we could connect. And once the connection happens, then I think you can slowly direct the child that okay, ye karo, abhi wo karo. But pehle aapko uska direction lena padega. I think that would work with very limited capacities. But I really admire the kind of care. 4.5 years is a pretty long time.
Deepti ma'am, with your permission, I would like to just add here.
Yeah, please.
I read a book about a child like this. The child was assessed MR, and there was no way anybody could help a child. So the book is written. I can't recall the name of the book right now. The therapist just spent time with the child. That's how the whole story began. She would only spend hours with the child, probably doing nothing. So there is no goal in the time. There is no plan in the time. There is no structure in the time. Her mission was to just go and be around. And then slowly she started pushing white paper, color, clay. She kind of kept a lot of resources around her and kept pushing it without even talking to the child. In times when the child didn't move, and this therapist started drawing, started coloring herself silently without any communication. I think it's written that for a couple of months they were not talking to each other at all. And suddenly one day the child, kind of drew something before this lady arrives in the therapy session. Which this lady never expected, that this child would draw, leave alone holding a pencil, which the child wasn't doing for months together. So I would suggest to Deepti is patience is something we need to carry a lot as educators or parents. And I think we just need to work without goal. Every time there need not be, a target.
I would interject a little bit over here. You can keep a target, and the target or goal is to establish a connection.
Yes, that's what. No, I mean to say like ABCD aa jana chahiye.
Yeah, not those.
Ye number aa jana chahiye. That's not the goal.
That comes later on. Yeah, that would come later on. So you can keep your goal. I think goal directedly jab hum kaam karte hain, to we automatically have a sense of patience also. If you know that what goal you need to keep at which stage, I think it will become easier.
Not academic goal, which is what schools do, that they must achieve these academic goals.
Yeah.
I have another.
Thank you so much, ma'am. Thank you so much. I got a really beautiful insight into it, Bala ma'am and Deepti ma'am. Thank you.
Thank you. Yeah, so there is a specific. I love to keep these formulas or phrases in mind. I remember a long time back when my children were really young. Somebody, or maybe I came across from somewhere that I read that when children are young, quality time is always a function of quantity time. You have to give lots and lots of quantity time, और उसमें से magically एक आध quality time निकल आएगा.
Yeah.
Just you cannot expect कि हाँ मुझे मेरे पास ये time है, अब this time should become quality time. It doesn't happen that way. So you have to actually be ready with lots and lots of time. उसमें से थोड़ा बहुत quality निकल आया, तो that's bonus for you.
Asking about time, ma'am, is it not time for your next session? I just saw the clock. It's already going to be 4.
Yeah, so we are just by the way, 2 of my interns have also joined over here. Not my interns, I think they are my colleagues. So they have also joined over here, and I would love to just mention them. One is Arushi Gupta. She's working along with me, seeing all the clients as I'm too much loaded with work. So she and Virakti, both of them share my workload. So they are also doing the same work that I'm doing with adults. And specifically, Virakti has a special inclination with special children because she was working with BM Institute in Ahmedabad for a couple of months as a teacher, also to teacher to children, or to teachers with specific needs. What is it? Can you tell us a little bit, Virakti?
Yeah, so I was working with adults who have intellectual and developmental disabilities. So I was closely working with their vocational instructors, and there I was also training students of rehabilitation psychology, postgraduate students they were.
Yeah. Virakti, are you classmate of Mahima by any chance? Because I keep hearing your name very often. Are you the same Virakti? I don't know.
Yes, I'm the same Virakti.
Yeah, okay. You all have done your masters together, right?
No, I pursued my masters from New York basically, but we were in the same class for a month or so. I used to go to the master's classes to get an experience of it.
Okay, great. Nice connecting like this.
Yeah, awesome. Yeah, you're right. Actually, I'm just loving the questions and loving to answer them as well. But unfortunately, we have another training, and both these beautiful ladies are going to assist me in that training. So we have to just go now.
Thank you, Arushi and Virakti. And ma'am, can we have you again sometime later when you have some more time? Because a lot of them have a lot of questions, and communication is a challenge even to normal people. So you can imagine how difficult it is for the special needs.
Extremely. Yeah, definitely. I'd love to come. You can call me anytime. I'd love to come.
Thank you so much, ma'am. Thank you.
All right. Yeah. Bye-bye.
Bye-bye, ma'am. Thank you so much.
Bye.
Thank you, Arushi and Virakti. So I'm still live for a while. If you all have any questions, you can still ask me. My community members, the questions which is posted here, I'll also try to contribute in that. Yeah, Bhageshri.
Yeah, same thing, ma'am. We listened to the parents who are, here with the autism, mild or moderate. But what about the teachers? As a remedial educators, we mostly deal with the LD children. But when these non-verbal children come to us, even they do nowadays, those parents also approached us. So how we have to start with the communicating with these children who are not having any eye contact, or those who comes in the very first time, or maybe our first few sessions, or how to begin dealing with them basically.
Yeah, so I recently did it with somebody in around my place. So this child was between 2.5 and 3. So the parent was not able to handle the child at home and wanted to send the child somewhere for some classes, but no school would take this child. So I had one of my students to do it for the child, and I went to see the child there. So the child doesn't look at the face, he's all the time looking at things around, right? This is what happens with mild autistic kids. So what I would do is I'll tell you practically what I did. I would throw things here and there. So the child would look at that thing. Then I would go and pick up that thing and see how the eye is going. For example, I've thrown a pen. So the child's eye would go to the pen, then I'll move towards the pen and gradually lift the pen and see if the child is looking at the pen. If not looking, the child might look somewhere else. So I'll go and pick up that object. So I am moving. I'm not asking the child to move anywhere. If the child moves somewhere on their own, it is okay. I don't stop the child from moving, but I am ready to move in every corner and do this for the child. So at one time, what happened, I did it for almost 20 minutes. At one time, what happened when I picked up object again and again, the child was looking at the object. Now I brought the object to my eye level. So now what happened? Now the child is automatically looking at me, and slowly I remove the object from between us. So now if I do it to you, you don't want to look at me and you want to look at, a balloon. We all do it. I think when we are angry with a spouse or when we are angry with somebody, we don't want to look at that person's face. We'll sit looking somewhere else. Now, what if that person, what do we adults do? We come and stand in front of that person, you look at me, right? So we as normal adults understand it and react to it, but our little kids with mild autism do not. So again, they look somewhere else because they don't understand that eye contact connect. So I did this with these lots of objects with them, and finally I got the child's eye contact. So next time what I did, instead of going and picking the object, I started keeping all the objects in front of my face, because now the child was interested in the object and not in me. But I was interested in the child looking at me. You understand the whole process? And finally, the object didn't exist between us. It was me and the child. Though we didn't do any communication, but at least I can say that in the duration of 30 minutes, the child would have looked at me at least 3 to 4 times. And I call it success. Even if it is 3 to 4 seconds, I call each of these. That's why I say, what's the goal of your session? The goal of my session was at least the child should look at me once. So I have crossed the goal and made it 3 times, which means I've already reached higher than my own goals. And like this, slowly, now I started making weird sounds, horrible sounds. I started doing things by which the child was distracted. Okay. So suppose a child is looking somewhere and I made some very funny sound, very unexpected sound. It's a human behavior of the person to look at that side. So the child automatically followed the sound. And in that sound, I was there again, looking at him. And like this, I caught the sight of the child many times. And now the child, the student who's dealing with this child is a member of a community. Now she says the child is just like any other child, like looks at you, and though the vocabulary is very less because of autism, but is actually communicating to you through the eyes. Then I started doing parts of the body with the hand. Like I would touch my nose, I would touch his nose, I would touch my ear. No talking is going on here. Because anyway, vocabulary didn't make sense to me. What meant was just connect. Then I would pick up a doll and hug it. So I was wanting to know whether the child is copying me or not. Or I would ape something which the child is doing to give that connect. Okay, you did this, I also do this to you. So somewhere the child started feeling friendly with me. So that's the initial stages of connect that started with each other. And then for me, reading, writing is the last thing, which is what I say in every session. I don't give any importance to academics. That's the last thing. Once the connect is made, the child can do PhD with you. But if the connect is not made, you might be an IITian, you might be anything under the sun. The child will not study.
Thank you very much, ma'am. It was really challenging.
Yeah, silence is sometimes the best communication. Especially with mild autism, you should not talk because they hate sounds. Whenever there's a change in the sound, like between teacher A and teacher B, the child is happy with teacher A and suddenly this teacher B comes and says something, the child does like this or ignores, because now the child is comfortable with a particular female or male sound, not even a teacher, a female. It happens even in family members. So the minute a new family member comes and starts saying something, the child is like, I don't like this sound, and the child would avoid you. And then we adults say it, इसका behavior कितना खराब है, मेरे को देख के चला गया. you're not able to follow कि उसके खोपड़ी में ये sound को लेकर कितना problem चल रहा है कि वो sound accept नहीं कर रहा है. He doesn't even know वो काका है, मामा है, चाचा है, कौन है. For him it is like नहीं सुनना. I'm okay with the other sound.
Ma'am, I have experienced this. When the girl come to me for the first time, I was talking to her mother and she was quietly sitting, not doing anything. Suddenly I asked her, "Hi Jnaneshwari," and she shouted. Everybody around looked and everybody was frightened and scared. She shouted so loudly. Only I called her name. So
In our
this is really-
center, there were some parents who didn't know, who couldn't understand autistic children. They'll just come and say anything. So we had the system that I knew that ex-parent will walk in at this time. So we would take away these kids to another room so that their routine is not disturbed, because you can't keep counseling the adult parents all the time कि हमारे पास ये बच्चा, आप ऐसे मत बोलो, आप जोर से मत बोलो, आप धीरे मत बोलो. So I would say parent को समझाना is very challenging. अपने बच्चों को लेके जाओ. So we made a timetable where we would shift these children to some other room when we knew that there was this puzzle, or when we knew that, you know, some visitors are going to come. I had lots of visitors in my campus. So for them to accept these visitors is also a challenge. So I would tell my team कि ये वाले visitor के साथ इन बच्चों को interact कराना है या नहीं कराना. You know, we would prepare ourselves so much so that kids are not disturbed by their routine, because autism, which is the other one, Down syndrome, these kids can't take change too fast. They have a pattern in which their brain works, and that pattern is disturbed, they get very agitated, and we then call them that they are rude. They're not actually rude. They are expressing that inacceptance of the change. That's all. Kavita, your hand is up. Thank you for that question, Bhageshri. How do you... Somebody wants to ask a question?
Ma'am,
Sony.
actually, this is what I was seeking. I mean, I'm more satisfied with this answer for my question, because now I get like denials how it should be handled.
All right.
Because,
Thank you, Sony.
The child is not on the level where he will express. It's me who has to,
Yes. Yes.
you know,
So
understand.
I'll also answer Deepti's question here. I don't know if she's there, but anyway, it's a very good question. It can help all of you. So we had a child of age 3 who joined our center. Now, this was a regular school, preschool. Now the child will not enter the campus, will not enter the class. So the child will always sit on the rocking chair, rocking horse. You have these horse, they keep rocking in the garden. So every day he would come to school. There is no denial to come to school, but there's denial to get into the classroom. So one day, 2 days, I did my normal things, counseling, and wahan toys, hai, phalana, tikana. And after third day, I think I failed. I said, no, I'm not doing this. I just left the child there. So the teacher also did a lot of love and care and all that, but it didn't work. So he was rigid. He would hold on to that horse's ears and like, you know, very tight. Ki mujhe yahan se mat le jao. So I told the parent, you don't worry, you go. Let's see what happens. You will not believe the child was there for 3 months. I did not bother. I'm not somebody who breaks, who believes in following rules of the school. मैंने school के rules ही तोड़ा है पूरी life. So I would find this child there, and new parents coming would say, अरे इनके school में तो बच्चा पूरे दिन बाहर बैठा रहता है. So for me, I don't care. So I tell the parent, yeah, रहता है. So if you're okay, take admission. Otherwise, don't take admission. Because I know what's happening with this child. So this child has rigidity to enter the classroom for whatever reason. We don't know the reason. Neither is he telling the reason, nor is he communicating to home, nor is he denying to come to school. आना रोज है तैयार होकर, अंदर नहीं जाना है. So I was happy कि he was coming. So now what happened? He was there for 3 months. Once in a while, we would drag him to the class, to his class. This was nursery, and allow him to peep the class from the window, just to see what's happening, and make it exciting for him to enter, but he would not. So we changed the drill reverse. There are 22 children in the classroom. I asked the teacher to bring the 21 outside. So every day for 1 hour, the 21 will come out and hang around this child. मतलब प्ले टाइम, एक्टिविटी टाइम, जो भी नाम, ड्राइंग करोगे बाहर करोगे, राइम करोगे तो बाहर करोगे, so that we know how this child reacts to having this audience around. That's where we realized he was okay with the children, but he was not okay with going into the room. So then the connect between the kids started, they started talking slowly, but 3 months the child did not go into the classroom. The father of the child was recently a speaker in our community. Dr. Himanshu Patak had come here and shared, because he's a yoga psychotherapist. He did an amazing session in our platform on managing your mind. The recorded version of that is there on my YouTube video. You must watch this video. So he has mentioned it in the session also. I still remember how my son wasn't entering your class for 3 months and still he did it. Today he's completed his 12th and now he's appearing for his MBBS. कुछ नहीं होता है. कुछ नहीं होता है अगर बच्चे क्लास में नहीं जाते. World doesn't end at age 3 or 8, 4 or 8, 5. No. Just go with the flow. These kids will do amazing work. Just believe in what you are doing. And like ma'am beautifully said, ask yourself, are you okay to bring yourself to that level? Ask yourself, are you actually understanding the child or not? Or are you toppoing your own beliefs on the child? Which is the biggest mistake we are all doing as adults. We feel we are right. We are not ready to understand what the child's version of things are. Yeah. Thank you. Shweta, you have some question. Can you introduce yourself, because nobody knows who you are? Shweta.
Okay, I just can you hear me?
Traveling, yeah.
Yes, so I just recently joined Balaman's community and class. So I have been with the preschool for the past 9 years, and I'm keenly interested in trying to help out the children who have any kind of difficulties with learning, etc. So my question was, ma'am, in school right now we have a child who's in nursery. He's 3 years old, almost for 3 years, 8 months. He doesn't say a word. He doesn't pay attention to any, you can say anything, you can make any loud noise. He doesn't pay attention to it. There is no eye contact. He just keeps walking the entire day, and he removes his, just removes his clothes. He's very uncomfortable. So the parent has put a lot of belt and suspenders and all that, but he manages to remove it. And there's nothing else. He just keeps walking around the class the entire day. And the problem is, the mother says he talks to me at home because he only understands Oriya. The father says, no, there is something wrong with him. Something has to be done. So the parents itself, they're not ready to listen. I mean, the mother especially, she doesn't want to hear about anything, any problem that her son might be facing.
Yeah. So Shweta, this is very normal, absolutely normal. So there are 3 things it should do immediately. Agree with both. Okay. Number 1, yes, agree with the mother that she's right. Yeah. Tell the mother to get his voice recorded when he talks to her at home, because she's saying he talks to her. Which means if there is a proof that he talks to her, you will have that proof with you. A lot of mothers I have met have said this. नहीं घर पे बिल्कुल नॉर्मल है, आपके स्कूल में प्रॉब्लम है. So this is very normal. So I accept it. ठीक है, मेरे स्कूल में प्रॉब्लम है. आप ठीक हो? So get me a proof that the child speaks very well. Maybe it is right. Maybe it is 100% right that the child and the mother talk and the child is not comfortable talking to anybody else. At least now you have a proof that the child can talk, so you don't have to work on his speech therapy. Got it? You're not getting into the idea that yes, speech class mein le jao, speech test kara, wo sab to zarurat nahi hai, because the child can talk. So what will you do? You ask the mother to record that voice and send it to you, the conversation between the mother and the child. Now you listen to that conversation, whichever language it is, doesn't matter. If you can get the Oriya translated by somebody, you will know what the conversation was. Now make him hear his own voice. Are you there, Shweta? I think we've lost you, but I still give the answer. So make him hear the voice. And whenever this voice is played in the classroom, ask all the children to clap. Every time you appreciate his voice being clapped, he will start making small attempts to speak. All this I've done. This is my practical experiences which I'm sharing. I'm not experimenting anything at this moment. They're all done. So there was a same story. There was a parent who had this ghar pe bolta hai, ghar pe bolta hai. We got the whole thing recorded and we played it on the audio, full volume audio. The child was shocked to listen to his voice. And then he said, "Ye main hu." And the first time the child spoke in the classroom was "Ye main hu." So the ice was broken कि आप बोल सकते हो, आपको स्कूल में नहीं बोलना. Then I told him, आज के बाद बोलना मत. And then he started talking. Shweta, you must have missed it. The third thing you need to do is understand the father's version of it and ask the father to go in for an assessment. From the symptoms that you are describing, the child definitely has some percentage of autism. So if you know that yes, the child is diagnosed with this, then you will be able to make a proper goal for the child and guide the parent and the child properly. Otherwise, you'll just be throwing the stones in air without knowing which direction you're working in. So 3 things you must take action immediately. Within a week, you will get a clarity what you need to do next. I hope I have answered your question.
Yes, thank you.
Kavita, you have a question or you want to share something? Soon you will be sharing, huh? Kavita, you'll be an expert in this subject now.
Ma'am, I don't know. I'm trying my best to learn, attend all your sessions, and so many things I picked from that. But one thing I want to understand is you are answering somebody's query that some children don't like some kind of voices, and so I have a similar experience. I face with my son. He doesn't like Hindi to attend, and unfortunately, in Hindi class, the Hindi teacher sings also, which is no for him. So, is this going to be to set a routine? It's going to take time, or it's going to be forever?
Can't say. Really can't say.
Because he's very particular, ma'am. Anybody singing, even at home, off the chord, he comes and he closes her mouth and says, "Please stop singing," because he can't bear that off the chord noise.
Which means he has a sense of music?
Yes.
Wow.
He listens to music with the tones and with the notes and everything.
So that's a brilliant sense. Like, I don't have sense of music. I can't understand the tone and I'm so bad when I sing. So everybody shuts my mouth, reverse. Okay. So, but if he has that, that is amazing. Like, people have sense of taste. Unfortunately, I don't have that also. I don't have senses, I feel sometimes. So, so that's great if he has sense of music. Why don't you use this as a strength and explore here?
Fine, but how do I make him sit in Hindi class?
Why do you want Hindi? Leave it, no. I'm the last person to tell you to teach. I'll never tell you to teach children.
But one thing, ma'am, he is learning Hindi from
cartoon.
Any digital media, not only cartoon. He is learning from that. And when
the teacher is boring then. The problem is not in him. I will always say that problem is in teachers. My forever conclusion is that.
So teacher sings "Aa gaya, halwa wala aa gaya" and all that stuff, but he doesn't want to sing, nor he want others to sing without instruments and things like that. So I don't know how to handle the situation.
I got your problem. Are you very good cooks?
Okay, average I can say.
Who are the good cooks here? I am not. Ruchi, are you a good cook? An excellent cook? So if some relative in your family is not good at cooking and that lady volunteers all the time to cook, what will be your reaction? Especially when you have very special guests. What will be your reaction, Ruchi? हाँ, आप बोलोगे आप रहने तो आप सब्जी काट के दे देना कि आप थोड़ा ये वाला काम कर दो. That is what Kavita's son is doing. He is excellent at what that listening is. So he is telling the world, मत करो, please. मेरे को नहीं जम रहा इधर, आप लोग मत करो. So Ruchi will never allow that person to cook. If that person, like many people in my house say, तू बर्तन धो, तू kitchen के और मत आ, तू उसमें बहुत अच्छी है. I'm very happy washing vessels. I love washing vessels. मैं 10 घर में जाके I keep telling this, मुझे कोई नौकरी नहीं मिलेगी तो मैं बर्तन धो के तो पैसे कमा लूंगी. Is what I keep telling the world. So I don't know, I love it. I see the progress in that. यहाँ गंदा, यहाँ साफ, काम खत्म. You know. So Kavita, I'm coming to that point is he has an amazing sense of music. So now what you need to do is you need to play 3 or 4 different kinds of good, bad music and test Ask him to tell which is the right one, not the best one, the right one. And keep doing this with different music. Then find out what is his strength. And now you meet a music therapist. Next step in your town. That music therapist might bring some innovative technique to help your son, and not this Hindi teacher, definitely. And again, let me tell you, Hindi nahi सीखते थे, कुछ नहीं होता है, वो आ जाएगा लाइफ में. अभी नहीं तो बिहार में 2 महीना रहेगा, he will learn Hindi. That's not a big deal.
Not only Hindi, ma'am, even at a social circumstance, if somebody is singing, he says stop.
खत्म हो, he perfect. I got your answer. I gave the example with Ruchi's cooking. I think it's comprehensible, right? दोनों match हुआ है ना. Ruchi did this, खाना मत बनाओ. He's doing the same thing, गाना मत गाओ. Finished. Okay, Vanita, you have a question, or can we close it? This is nice. We're going to come like this only when we have experts. Attendance भी अच्छा रहता है. Vanita, you have a question?
Ma'am, I had posted one question.
Yes, Munira also has a question. 1 minute, Munira. Vanita has already asked. Munira, I think I read your question in the chat.
Yes, ma'am.
Yeah. So, okay. Can I answer you after Vanita's? Okay, Vanita, can you ask?
Ma'am, I wanted to share something, but you can answer Munira's, then maybe later I share a little bit.
Okay. So Munira has asked me, where is it, Munira? Munira, can you?
Yes, ma'am. Can I ask?
Yeah, please.
Ma'am, there's a child in nursery, just joined the school, and he is continuously crying. So even after a month, when almost all the other children have started settling, he keeps on crying, and the reason being that like social interaction he's not very used to. The mother has kept him away from most of the kids and relatives as well, because maybe the fear of infection or something. And now the mother is in bed rest because she is expecting the second child. So like I feel the child has got separation anxiety, doesn't want to leave and come. So what he's doing is he's biting and he's kicking whenever someone is trying to talk to him. So we tried, just like how you said, a parallel play. Like I was in the class and I was just playing on my own. I was not disturbing. We are not talking. But, teachers have this habit of continuously going and talking to children because they want them to respond. So what he does, he starts biting or kicking the maids or the teachers. So now, like, we are not understanding how to proceed further. Like, we have met the parents and we have understood the whole situation. We cannot revert back to the situation because the child has already undergone these situations. So now what should be the next step?
When is the new baby coming?
I think after 2 months.
So the child is aware of that.
He's in nursery. Maybe he's aware, but he maybe not
100%.
Verbal. Yes.
100%. Because a mama is always going to say, "Tumhara bhai ya behan aane wala hai." This is
Yes.
normal in Indian culture, or any culture for that matter.
Yes.
So 100% the child knows that. So there could be a possibility of non-acceptance of a new person coming, or anxiety of losing out the attention the child is getting, or probably the mother's health is not so good that she is able to give the same attention that the child was getting for 3 years because of her own, pregnancy issues. So reasons could be this, which we can't change. What can we change or what can we add is, one is asking the teachers in your school or wherever it is to stop asking him questions. हम adult को संभाल सकते हैं ना, बच्चे को नहीं समझ सकते, but we adults can stop asking questions. All that the child would probably need is space without these kind of distractions. Just space. 1 महीना ही हुआ है. अपने माइंड को बोलो, अगर 1 साल तक भी बच्चा ऐसा रहेगा, I am okay. If you tell that here, you don't have the pressure of अभी तक change नहीं हुआ, अभी तक change नहीं हुआ, अभी तक change नहीं हुआ, right? So the children never remain the same. They'll go on changing with time, but we need to give that time to that child. So adults can stop these probing questions to the child. क्या हुआ, क्यों नहीं बोलते हो, मुझसे बोलो, मैं देखो कितनी अच्छी हूँ, तुम कितने अच्छे हो. All this doesn't work all the time with kids, especially when they are disturbed from within and they don't know how to express. A 3-year-old doesn't know how to express. They don't have vocabulary. They don't know the words. So all that you can do to help the child to express is not to probe. रोता है, रोने दो. Now coming to biting. My daughter used to bite a lot when she was 3-year-old. She's bitten so many people. Every other day I would get a call saying, school mein aao. I was not working those days. And I would go there and the principal would be like, aaj bhi aapki beti ne bite kiya. I had no, aaj tak mujhe samajh mein nahi aaya kyun. And then I did not have so much samajh because I was only a mother. Itna kuch child psychology and all this gyan I did not have. So I probably was very bad with my daughter because I only knew she's biting and I would shout at her and I would bite her. There was a time when I started biting her back. But I think her biting stopped when I started biting her back to make her realize how much it is painful. And in those 2-3 bites, she stopped biting the other kids. This was nursery, exactly nursery. I'm not saying go and bite the child because the child is not yours. It was my child, so I could experiment. And I mean, that's not the right answer. That's not the right action to be done, but somehow it worked for me. Identify when does the child bite. उससे पहले क्या हुआ और उसके बाद क्या हुआ. This is called ABC way of finding out.
Antecedent behavior and consequence.
बस इसको अप्लाई करो, हर बार अप्लाई करो. दिन में अगर 4 बार होता है, 5 बार होता है, इसको अप्लाई करो और फाइंड आउट कि कौन कौन सी सिचुएशन में हुआ है. एज एडल्ट्स क्या हम ये सिचुएशन को अवॉइड कर सकते हैं कि वो सिचुएशन आने ही ना दे. लाइक हर बार कोई साउंड आता है तो बच्चा बाइट करता है एंड यू आर नोटिसिंग दिस कि 6 बार हो गया. तो हम बाइटिंग तभी रोक पाएंगे जब हम ये साउंड रोक पाएंगे. ओके अगर ये साउंड स्कूल के बेल का है तो हम साउंड नहीं रोक सकते क्योंकि स्कूल बेल तो बजता रहेगा. ऐसा भी होता है कि बेल बजते ही द चाइल्ड गेट्स एंजाइटी एंड ही डज समथिंग. दिस इज आल्सो इन बिग स्कूल्स. तो आप बेल नहीं रोक सकते बट आप बच्चे के साथ रह सकते हो उस समय. दिस हैपेंड इन माय स्कूल, माय बिग स्कूल. So this teacher would always tell me कि मैम जब भी बेल बजता है the child does this. So I told you I can't stop the bell because 5,000 kids are waiting to hear the bell. I can't stop the bell. But can you be with the child whenever the bell rings? Or can I place a masi or an aya with the child just to make sure the child unconsciously does not damage another child? और अगर वो काटे भी तो आप उसको काटने के लिए कुछ दे दो, कोई सॉफ्ट मटेरियल, कोई च्यूई, कोई बॉल या ऐसा कुछ. और दिस वे वी गॉट दैट होल थिंग आउट ऑफ द चाइल्ड. सो इफ यू आर एज एन एडल्ट, इफ यू आर विद द चाइल्ड एट दैट टाइम, यू विल नो कि वो क्या क्या बिहेवियरल रिएक्शंस दे रहा है एंड यू कैन प्रिवेंट ऑल दोज रिएक्शंस प्रॉपरली. सो एबीसी वर्क्स वेरी वेल फॉर एनीथिंग, नॉट ओनली दिस चाइल्ड. हर एक प्रॉब्लम के पीछे एबीसी पता करो कि क्या है. अपने आप हम वो प्रॉब्लम को अवॉइड कर सकते हैं एटलीस्ट 80%. या थैंक यू मुनीरा. वनीता, you can share your whatever you wanted.
Ma'am, first of all, I want to say thank you. It was such a beautiful session. Number one, I joined late, but whatever I heard, I loved it. And I loved the experiences, the insights that you have given through those experiences. They're so rich. You don't find them in the real world or in the school, colleges. No, you don't find it. It is just because you have gone through it, you have dealt with it, you have shared that with us. It's so rich and so innovative. Thank you so much. I really connected with that, and it has, I have gained a lot of understanding in whatever you shared. So that was very powerful.
This is one of the best experiences of my life. I'm interrupting in between, but I really want to tell that this is really a wonderful experience.
Very powerful, very, very powerful stuffs you have shared. Thank you so much. Another one thing, what I wanted to share was because someone was sharing about a child not going to school, and that time I realized that I have 2 children who are regular, like normal kids and all, and they both love to go to school before they could even go to school. But the day my daughter wanted to go to school, first day she started crying and she came back and she said, Amma, I don't want to go to school. Because then I tried to probe in and ask what happened, what and all. And then she said there is one teacher she likes because she's loving teacher. Because only reason she's loving teacher is because she took my daughter on her lap on the first day of the school. She came back with names. I have 2 teachers. One is loving teacher, one is shushu teacher. I said, what does that mean? She said, one is took me on her lap and another one did shushu, so that she didn't want to attend the class when that shushu teacher was around. And every time the loving teacher went out, my daughter became very anxious. And she said, and she came back. She was very verbal. So she came back to just tell me every day, Amma, I don't want shushu teacher around. I want a loving teacher. I don't like when the loving teacher goes out. This is just within the first week of the school. And I didn't know how can I help, So I just said, okay, you don't want your loving teacher to go out. Okay, we'll send a letter to your loving teacher. Come on, tell me what you want to tell her. So in her little words, whatever she said, I wrote a note and I read it out to her. Is this what you want to tell your loving teacher? She said, yes, Amma. I said, go and give it to your loving teacher. That was the end of it. And she started, and the social teacher also understood. She was so kind. She understood, okay, she wants more of that comfort. And so since then, that episode stopped. But when again to junior KG, my daughter went, the writing part became so boring. Every day it was same activity. She hated it again. And she started that whole episode of, I don't want to go to school. I don't want to go to school. I don't want to go to school. Every day morning. Every day we used to get late because I had to pacify her before going to school. But at the end, then I had to go, and I understood there's a problem in the school because the child loves studies. But if the school only is doing something is happening in the school that my daughter is not liking it. So I went and talked to the school, and then they are telling me your daughter finishes things very fast and other children are not doing things. So we pay more attention there. And so what to do, I don't know. Then I said, please work out something because this is the beginning of the school and she shows this much dislike towards school. It's not right. So then they have worked out something wherein they kept her engaged and all, and it was okay. And my son also started disliking going to school. The reason was because there were 2 teachers. The minute the other teacher comes in, my son hated it. So he said, Amma, I don't want to go to school. So lot of issues is with the teachers, how they are dealing with it, I felt. And once they get to know, the child is not liking and somewhere the teacher changes the method of approach, then things become all right. It gets sorted.
So having a B.Ed degree or having a B.Ed with special education or having an RCI certificate is not the be all and end all of things.
Yes.
Just for the namesake, like I shared an article yesterday which said the Goa government says now every school needs special educators and counselors. It's mandatory. So it's not about having those degrees and making the change. It's all about how much you can connect with the child and what change you can bring in yourself as a teacher or as a parent. That's all that matters. Your degrees ko jala do. That's why I said, मुझे कोई फर्क नहीं पड़ता आपने B.Ed किया नहीं किया. Are you ready to learn? Everybody who joined this community, they asked me, will you give us an RCI certificate? I said, I will not give you anything. Don't ask me for certificate, but I'll give you more than what anything you can get is your experiences with these children. And that's what matters in life all about, right? Thank you, Vanita, and thank you for all of you for these lovely feedback you've given me. Thank you, Priyadarshini. Ruchi, you have something to say? Yeah.
Ma'am, it is not connected to the questions we're having, although the session was amazing and before and after was more amazing for me. I just want to know, when you put this recording on YouTube, you will not edit, right? Because there are so many things we would like to hear. So please upload it the way it is.
Sure, I will not edit.
Yeah, thank you so much.
Whatever is live sessions, I don't edit. All these expert sessions, I don't, because let the real thing be heard by so many people who are not a part of our community. We are not even a molecule to the size of people who need this kind of lessons, right? How many are we? In our community today, we are 200 people. That's all. Though my mission is 1 lakh, but hoga jab hoga, lekin more than 30-40 million people need to hear all this. So it'll just go the way it is. Whether they like me biting my daughter or not, irrespective to me. But there are so many ways to deal with the same problem. It's just that it gives you an eye opener. Acha, हम ये भी तो try कर सकते थे, हम ये भी तो कर सकते थे. That's all. Yeah. Sure. Thank you so much. See you all. Bye-bye. And again, next week, I'm coming up with another amazing person. Bye-bye. And yes, if you all have some great speakers like this in your network, in your cities, and you feel that they can add a lot of value to our community, kindly connect them to me. I'll personally talk to them and invite them to come for the sessions like this, because I want to keep this like this throughout life. See you. Bye-bye.